Hi, welcome to the second episode of the topic I started about ulcer. If you have not watched the first episode, it's important you watch it to understand where I am coming from. This is your Health Your Life program with Dr. Innocent. Open your mind and listen attentively to get the points I'm going to make on this episode that will help you a lot. Let me first talk a little about ulcer because it's like most people don't know what ulcer really is. Hence, they fall prey to the menace that the word ulcer causes. They become victims for trying all they could, treating ulcer, believing ulcer is what they are suffering from. Let's get started. Peptic ulcer is what patients usually complain about. Peptic ulcer is an open sore that develops in the lining of the stomach or small intestine. It occurs when a rare condition called Zollinger-Ellison syndrome causes the stomach to produce much acid that damages the lining of the digestive tract. There are two types of peptic ulcers: gastric ulcer and duodenal ulcer. Gastric ulcer occurs in the stomach, while duodenal ulcer occurs in the first part of the small intestine. Common cause of these ulcers are infection of the stomach caused by bacteria called H. pylori and regular use of pain relief drugs. But the most cause of it is H. pylori bacteria. Most people with peptic ulcers have this bacteria living in their digestive tract. Yet, majority of people that have H. pylori bacteria in their stomach do not have ulcer. Most ulcers occur in the first inner surface layer of the inner lining of the stomach. Have this at the back of your mind. Now, if you have been treating ulcer for months or years, and you are still having the same symptoms you have been having before you started treating the ulcer, or the symptoms are even getting worse, and you still go from one place to another believing that ulcer is what you are suffering from, please pay attention. It doesn't matter the hospital or clinic you have been to. It doesn't matter the different types of tests or scans you have run. It doesn't matter the type of symptoms you are having. Be it chest pain, stomach pain, difficult breathing, hotness in the body, bloating, or any other symptoms that people claim to be ulcer. As long as you still believe that ulcer is what you are suffering from, please, I repeat, pay attention. A lot of people are going through hell because of ulcer. So open your mind and listen attentively. You will learn one or two things that will help you out of that sickness. But before I proceed, let me say this. I hear many people say that ulcer cannot be cured, hypertension cannot be cured, heart disease cannot be cured, etc. Every sickness don't have cure, they say. Anyway, if you have heard such things before, I don't know whether you believe it or not. But the fact remains that God, the inventor, the architecture, the designer, and the creator of human being, put every mechanism necessary in the body to heal itself. He created the raw material necessary to help the body cure itself of any disease, perhaps it was sick. That is the fact. We are spontaneous self-healing beings. Our body was designed from the day we were born to heal itself. Know this, the human body knows how to heal itself. The human body wants to heal itself. And most of the times, the human body heals itself, even without us knowing. That is how powerful the human body is. It is not a rocket science. We have helped many people cure their health issues based on this knowledge. When we talk about cure advanced health, we don't claim to be the ones that cures, no. What we do is, we dictate exactly the root cause of the patient issue and advise him or her on what to do based on his or her symptoms and the state of the issues to supply his or her body the right material necessary to heal and cure itself. That's all what we do, and cured is achieved. In God's own science, there is cure for any disease. Back to the ulcer discussion. It pains me so much when patients complain to me that they have been suffering from ulcer for months, 2 years, 6 years, some even 10 years, And I'm always flabbergasted about it. Ulcer is one of the common sickness to be cured within a month and 2 weeks. As a matter of fact, your body's innate healing power can cure small ulcer within 1 to 2 weeks, even without any medications. Yes, any ulcer that refuses to be treated or cured within 1 to 2 months should be properly diagnosed and evaluated before it is too late. If your ulcer refuses to be treated or cured within 1 to 2 months, know this: it is either ulcer is not what you are suffering from, or it may have become acute, chronic, or complicated. And if it has become complicated, here are some of the symptoms you may have. 1. Internal bleeding. Internal bleeding can cause severe anemia or blood loss that you may need to be admitted in the hospital, or blood transfusion. This type of blood loss may cause you to vomit blood, or black-colored vomit, or black or bloody feces. 2. Obstruction in the digestive tract, which can block the passage of food, causing you to be full easily when you are eating, to vomit or lose weight. 3. Perforation, a hole in your stomach wall. Peptic ulcer can eat a hole through the wall of your stomach or small intestine, putting you at risk of serious infections of the abdomen cavity. 4. Stomach cancer. Stomach cancer can cause pain or burning sensation in the abdomen, heartburn, indigestion, fullness too, even after a small meal, nausea or vomiting, loss of appetite, weight loss, swelling in the abdomen, unexplained tiredness or weakness, blood in vomit, black color feces too. If you still have any of these symptoms after treating ulcer for 1 to 2 months, I advise you to stop the treatment. Stop harming yourself the more. Try to find out what exactly is wrong with you before you continue your treatment to be sure you are treating the right issue. Some of these symptoms are also symptoms for other health conditions like pancreas issue, heart-related issues, gallbladder issues, thyroid issue, and many other health conditions comes with almost the same symptoms. Yes, it comes with almost the same symptoms. The human body is the most complicated mechanism ever created. That's why accurate diagnosis is very important in the treatment of any disease. Let me make this clear for those of you who is about to start treating ulcer. If the first symptom you have is not stomach pain, not just pain, but pain that comes with burning sensation, and you are told it is ulcer, be careful. The pain can be anywhere in your stomach, upper abdomen, or belly button, which is between your navel. The pain usually occur or get worse when your stomach is empty, and may reduce or stop briefly when you eat certain foods. It may last for minutes to hours, or may come and go for several days or weeks. The pain may also be worse between meals and the evening. These are the first symptoms of ulcer. If you did not experience any of such symptoms first, before you start ulcer treatments, I repeat, be careful. Many who tried it are going through hell today. Again, remember, ulcer is an open sore that develops in the lining of the stomach or small intestine, and most ulcers occurs in the first inner surface layer of the inner lining of the stomach. What does that tell you? It simply tells you that the first symptoms to notice if you have ulcer is in your stomach region, not back, not chest, and not in any other place but in the stomach region. Understand what I'm saying. I'm not saying that ulcer symptoms cannot spread to the back, chest, or any other place. No, that's not what I'm saying. What I'm saying is that ulcer symptoms must first start in the stomach region. Before ulcer symptoms can spread to any other place, it might have become either acute, chronic, or complicated. You and I know that once anybody notices pain or burning sensation in the stomach, he or she must go to pharmacy or hospital for solution. And if ulcer is actually the problem, There are 3 or 4 different types of medication likely to be prescribed to neutralize and reduce the production of stomach acid, prevent further damage to the ulcer, heal the damaged tissues, protect the stomach lining, and kill the H. pylori bacteria. This treatment process will not exceed 1 to 2 months to be completely cured. Yes, what I am saying is scientifically proven. I want you to reason and think critically. Ulcer is an open sore in the stomach. You have an ulcer and it is cured. How and when can it cause chest pain, back pain, difficult breathing, or any other symptoms? 6 months, 2 years, 6 years, 10 years. Think. I'm saying all this based on practical experience, not theory. Patients usually come to us at the 11th hour when every other things they have tried fail. So I'm not telling stories. I'm telling you out of experience. I hope you understand the points I am making. Don't be a victim of wrong diagnosis. Taking ulcer medications without having ulcer might cause you more harm. It comes with severe consequences most of the times. Be informed. I will stop here to continue on the next episode. If you have tried all you could because of ulcer, yet to no avail, come to us. We will help you out of it. It doesn't matter how long you have been suffering from it. If you are looking for accurate diagnosis or a holistic approach to your health issue, contact us today and you'll be glad you did. Don't keep this information to yourself. Share it to save others. I am Dr. Innocent, a holistic physician, servant and facilitator of nature. Thank you for watching.